said, thank you very much for taking this initiative. I've been to this beautiful office number of times, but as a friend, but first time I have visited this officially. So in that sense, it is very satisfying for me. Many vice chancellors I have had personal relations, down from Dr. Singh, who was admitted, and many others. So we have a very, very long association with the honorable scientists of PAU. In fact, my own Chachaji, Dr. Gurjeet Singh, was a plant breeder. My wife's Masterji served here, he was a cotton breeder. So we all have, since I am from an agricultural background, my Dadaji was an agriculturist, my dad was a doctor, but we used to visit PAU as a young boy also. So we have very, very great respect for this institution, and as Bishav said, every day morning, in fact today also I have to collect my morning pass, that fellow Gurjeet rang me, after that you can collect it after your MoU. So we come here every day, and so it's a great pleasure to come here today. Yes, the affair, I would say the relationship and the love affair was there, but today it has got formalized with this MoU signing. So we will take certainly forward this association. And as Dr. Tut said, our proximity to each other is one of the biggest factors which we should take it in account and move forward. We also in DMC have been involved in a lot of research. In fact, the other day we had a meeting. We have an NIRF rating of 35 in the country, DMC has. So we had a meeting as to how we can push it up, and one of the biggest factors is PhDs and whether you are taking people from all across the country. And so we did have a brainstorming session, and for us to be sitting across with someone who are number one in the NIRF rating, you can well imagine how overwhelmed and how satisfying it is for all of us. We have had a long association with Vasu also. In fact, I would say signing an MoU is the first step, and anything that is well begun is half done. But a lot needs to be done subsequent to this, and I would say it depends upon all of us to take it forward. And I would say none of us wants that this gets signed and it remains on the papers only, because it should translate into some meaningful, I would say, services to the state of Punjab, and maybe we can make a benchmark in terms of some significant change we can bring in the state of Punjab. You are in a position where you are, and we are also striving hard to improve our services, and we have in that sense achieved quite a lot by our standards. DMC today was actually rated as the best private medical college in North India. And not only that, most of the actually central bodies now recognize as DMC being a not-for-profit organization. And we have, as Sandeep also said, 100 MBBS seats. We are more of a super specialty institute, and you all know the infrastructure and the kind of services that we try to provide to our patients here. As Bishav said, our key areas of research have been cardiology, gastroenterology, neurology, and social and preventive medicine, microbiology. In fact, the year in 1988 when I came here, one of the first animal experiments we did was with one Dr. Gupta, who was here in pathology department, and we did some research on oils. And as you said, canola, we've done some, I've had a PhD student who was working from PAU with us. So we have done a lot of actually collaborative work already. But now with this formalization, in fact, I did apply my mind yesterday, and I thought some of the areas where we can look for each other's collaboration could be, as ma'am said, dietetics, of course, home science. We've all known that statistics is one of your strengths. We will need, and we can actually look forward to. In fact, the year I came here, I realized that I was told by one of the person here that there are 6 professors of statistics in PAU. So I was really surprised. In the medical system, it is hard to find good statisticians. Sir has biotechnology, and we also have a lot of emphasis on genetics. In fact, couple of years back, stem cell and genetics were propagated as the two things which will take medicine forward. But stem cell therapies have actually gone a little bit, they've had a hit because of some negative outcomes. So today genetics is the thing people are really looking at, and we are also developing genetics. We have in fact state-of-art equipment. Food varieties, yes, as you said, gluten-free. Actually, one of our consultants was trying to work at gluten-free wheat, if we can. So such kind of things. You also mentioned low glycemic index foods. That is an area which, as clinicians, we keep looking at, and we can collaborate in that. The second area I thought we could do some collective work is we can have collective guidelines for the general public on the use of millets. As you know, it's a millet year. Right oils people have, and high protein, high fiber diet. So these are some of the things that we can all work for. I have participated personally in the farmers' melas here, and we can have a regular participation, give advice to farmers on healthy diet. Bishav has taken upon himself hypertension, and we screened 1.5 lakh people of Ludhiana. We primarily worked at industrialists, and he has created a very good model of one child teaching checking 20 persons' blood pressures. So something of that sort can and should be done. But Gosal has actually collaborated with us in a very massive manner in that. We can do free blood pressure, free sugar checkups, and all those things can be done. In terms of publications, yes, we can learn a lot. In fact, from the PAU, Dr. Uppal is a regular member of our ethics committee, and we would request one of you to actually spare your valuable time. One of us can be, because if we have to take forward this association, some sort of a regular exchange program needs to be developed, because you are also very busy and we are also busy, but unless we make some regular sub-unit exchange programs at a departmental level, that is what is going to sustain this MoU, and it is our wish and desire that we sustain it for a long time. We come out with some useful things. Our doctors can contribute actually in some of the publications and some of the field work that you want to do with farmers. Teaching is a very important area of yours, and it is also very important. Skill development is another. And some common departments, actually we can have skill development programs like HR, management, research methodologies, teaching modules. The National Medical Council is now bringing out a lot of changes in the teaching methodologies. Some of your teaching methodologies we can have an exchange in terms of methods of teaching and skill development. We can have clinical and practical postings for PAU. I believe a lot of PAU students already come, but we can have it in a structured manner, and whatever way we can help. A new program which has started by the National Medical Council is we are asked to adopt villages so that our students have a connect with the normal people. I would not like to use the word patients, but with the normal public. So every student has to adopt a family, and we have to adopt villages. So you people have actually a huge presence in villages, and so in that sense we can have a public connect also to a large extent. I know you people come out with a lot of publications, and our doctors we can have a health. Actually, your department of mass communication is very strong. In fact, one of our girl left us. She's joined your department yesterday only. She was saying that. We can contribute medically. Farmers will gain a lot. So whatever suits you can be done. We've done some work with IIT Ropar. We have developed a blood pressure apparatus. We are developing some beds. A lot of work has happened with IIT Ropar and Gosal. Many zoonotic diseases which reach human beings from animals, they are called zoonotic diseases. A couple of our colleagues are working in that area. One of our colleagues went and taught echocardiography to they were doing dog echocardiography. So there have been a lot of, actually, I would say, such programs. And I would say genomics would be another area where we would love to actually work with. You just said that you have presence in every village. In fact, a couple of months back, the present Chief Minister asked us to work on anemia elevation, because I believe anemia statistics of our state are one of the worst actually. Although we claim to be the food grain capital of the country, but we are amongst the 5 worst, lowest statistically placed states in the country in terms of anemia amongst pregnant women and among children. So you and us and the government system can work. So there are a whole lot of areas in which we can work: teaching, publications, associations, public connect, and we are very, very excited. But it is upon us, since the top scientists of PAU are sitting here, I would urge and request each one of you to apply your mind and at least connect with us and connect with us on a regular basis. Let us not hesitate, because Sir has taken his part of initiative and he has connected us. Now it is upon us to take it forward. And whenever there is hesitation, it doesn't actually give any benefit. So let's all break the hesitation and connect with each other. Something will surely come out with the association discussions and deliberations. And I really look forward to a positive and an outcome-oriented association between the two organizations. Thank you once again to the Honorable Vice-Chancellor for having taken this great initiative to connect us all.